Yeah. I'm Dr. Marco Lowe. I'm a family doctor at Magenta Health. We're a family medicine clinic that's just down the street from East Chinatown here. In terms of succession planning, we've been told about this issue, I think, about 4 to 5 years ago, that there was a concern that there are a number of older Chinese doctors in this Gerrard Street area that were close to retirement, and we were approached by the local health network to see if we could help with some of the succession planning. I think more could have been done in the meantime, but we've gotten to the point where now my understanding is that there are 1 or 2 doctors that are about 1 to 2 years close to retirement, and it's time to really action on some plans. As for the East Toronto Family Practice Network, we're a collection of about 190 family doctors in the area that are working together with the Ontario Health Team. And we are therefore looking at the succession planning issue. My understanding is there are up to like 5,000 patients that might be orphaned in this area. And so the clinic that I represent, another clinic down the street, and potentially another clinic just north of us is going to try to look into this issue. We're going to need support from the Ministry of Health and Ontario Health to see if they can help us recruit new physicians to come into this area, because there are definite challenges with taking over a practice from highly experienced physicians who have taken care of the practice for so long and know the patients so well. So we're going to need some support from government as well.
So I believe you're locally trained doctor.
Yes, so I trained at Toronto Western Hospital in the Bathurst area. Yeah.
So normally how you select the location for your private practice?
Yeah, so I would have to say that a majority of doctors currently select based upon where they want to live and also based upon the patient population that they want to serve. And it's a balance of that. Living sometimes close to a certain location because you have to, because your family is there or your partner is there, but also trying to balance the career part of it as well.
So you freedom your choice to select where you live?
Yes, a bit of both.
It's not assigned by the Ministry of Health? No.
Currently, no. I think there are certainly some programs that try to encourage doctors to move to different areas. For example, certain high-needs areas in Northern Ontario. But I think in certain circumstances, it's just very difficult for life circumstances to be elsewhere. Let's say your partner works in downtown Toronto and can't move and there's no job for them elsewhere. You kind of have to live in Toronto.
So then have to strike balance.
Yes, it's difficult. I don't pretend to have the answer for it, but I do know that in our area, we already have a shortage of family doctors. We currently run a very long wait list at our clinic. There's my understanding that there's a long wait list for Bridgepoint. There's a very long wait list for Albany Clinic as well, which means that people need family doctors. And even us, even down the street, even in a very different type of practice, to be honest, in a very new, highly technological clinic, it's still difficult to recruit physicians to come and settle down in the area. And that's likely because of some of the rules set in place by the Ministry of Health. So we're hoping to work together with them.
It's not underserved in this area?
It's not considered an underserved area, but we would argue that based upon the patient wait list that we have, people still need family doctors. Yeah. And as you can see, there's a retirement issue coming up too.
Yeah. Population growth.
There is significant population growth in the area, without a doubt. There is a large, Corktown, just south of us, there's a massive amount of development there, and we're certainly seeing a number of patients come from that area, and it's difficult to service that population because it's just expanding so rapidly. Yeah.
So last question about this topic. Do you think anything the Ministry of Health can do anything?
Yeah, so I think it would be if the Ministry of Health could work with us to open up certain types of payment models and care models that are currently closed to us, then it would be of great help. These models typically were in the past open to us, and current new graduates really gravitate towards those programs. We just we're not allowed to offer those programs currently in this area. If the Ministry of Health was willing to work together with us to maybe open some of those programs, I think we'll have a less difficulty with recruiting physicians into this area.
And also, I think you have the health team in this area too. East Toronto have complex health team.
Yeah.
Will that be able to provide a real objective suggestion and advice to community health?
I think so. I think one of
They have to listen to you.
Yeah, I think one of the major benefits of coming together as a family practice network and then working with our wider community health partners, it already has borne fruit. Right? For example, the COVID-19 issues that we spoke about earlier, and certainly with their help, with our partners at the hospital, at Wood Green, at VHA, with South Riverdale CHC, which is just down the street and also serves a major Chinese-speaking population. I think together with them, we understand the healthcare needs very well in this area, and we could certainly provide the ministry with data and needs and patient needs of this area. Yeah, I think together as an Ontario health team and with the ministry, I think we can find a solution to this.
Yes.
And Marco, you know Marco well.
I know Marco. We'll have a different project. That's it.
Marco is our leader.